Hi, I'm Phil Sunshine. I'm an Emeritus Professor of Pediatrics at Stanford University School of Medicine. I consider myself Emeritus, and that has certain advantages. I get a free parking sticker, and I have access to a lot of the university benefits that are much less expensive for emeriti than they are for full-time faculty. I don't consider myself retired. I consider myself as working 3/4 time. I actually work about 90% time, but I get paid for 3/4. Well, I really enjoy the work. I enjoy the people I work with. They're very wonderful people, and I've always been fortunate to work with people who enjoy their work and who really look out for each other and try to make contributions together, rather than having one person do his or her own thing, another person doing his or her own thing. It's often that the people are working together on common projects. The neonatology is the care of infants, usually up to the age of about 3 months, mostly focusing on very prematurely born infants and then very sick babies who have various types of illnesses, infection, congenital malformations, acquired illnesses, and things like that. The patients that I take care of are infants. They are babies who no longer require intensive care, like being very prematurely born or being very sick in the newborn period. They're over their acute episode, and now they're learning how to feed and grow, and we're there to help them learn how to nurse, how to maintain temperature, and during this period of time we are also educating the parents on how to take care of these patients when they go home. My job is very different now than when I was working in the nursery, intensive care nursery full-time. When I was in the intensive care nursery, we would have up to 40 patients at any one time. There would be 2 teams, and we'd be taking care of critically ill infants. Either they were born too early or they had various types of critical illness that required intensive care. There was a lot of teaching at that time because there were medical students, interns and residents, and postdoctoral fellows. So while we were taking care of the patients, we were also educating these young doctors in the area of intensive care for infants. And now in the intermediate intensive care nursery where I work, there are no medical students, no residents, no fellows. So it's all educating the parents and the nursing staff with whom we work. Well, we don't consider it hours. What we have is how many weeks you're on service. And when I first started in this business, in this practice, there were 2 of us, and we would be on service each 26 weeks a year. Now, where I work, it's called the Intermediate Intensive Care Nursery, and there is no night call there. And the day is much shorter. It's usually about 8 to 4, sometimes 8 to 5. And we work about 10 weekends a year. So it's much different and much easier than when I first started. When I first started taking care of patients in the intensive care nursery, mortality rate was over 50%. If you were born at less than 28 weeks gestation, 40 weeks is the full gestation, and 38 to 42 weeks is what's considered to be normal. If you were born and were less than 28 weeks, you had less than a 10% chance of surviving. Now, not only are the babies surviving, but they're surviving relatively intact. We're not doing so well with babies who were born 24 weeks or below, but if they're born 25 weeks and greater, the survival rate goes up. The babies who survive without difficulties goes up, and it's really made a significant change in outcome. Also, when I first started, our interaction with parents was such that the parents were not allowed to come into the nursery because of regulations at that time keeping people out of the intensive care environment. And it wasn't until approximately I would say 65 or 66, when we start allowing parents to come in and become caretakers for their baby, that our whole nursery changed from being sort of a sterile environment to one where it's now family oriented. I think the baby's well-being has improved significantly. First of all, from the parents' point of view, they get to take care of their babies in a lot of ways while they're still very, very young. And they realize as time goes on, when they're in the nursery, they often can provide much better care than the nursing staff can or the physicians can. And they get to know their babies. And of course, the babies relate very well to them. I can tell you that I've been very fortunate because the field of neonatal medicine has just exploded during my lifetime. In 1963, when I finished my residency, there had only been 1 or 2 papers talking about neonatology. It wasn't even given a name. And then suddenly, there's so many new things that were brought in to the care of these babies, including to provide ventilation, mechanical ventilation for them, treatment of a major disease called hyaline membrane disease that was responsible for the death of President Kennedy's child in 1963. And since that time, very few babies actually die of hyaline membrane disease. And there have been so many other things that have come in, being able to provide adequate nutrition for these babies, being able to take care of babies who have had central nervous system damage. There have been an explosion in imaging techniques that had never been considered before this time. Many new laboratory techniques that have been developed so that we can identify and diagnose diseases that we never understood previously. So I've been so lucky to be involved in this developmental aspect of neonatology. Well, I have hobbies. I like to ride my bike. I like to play tennis. I like to do crossword puzzles, and now I've gotten addicted to Sudoku. And I do spend time with my grandchildren. I'm not sure if I retired, I'd spend more time with them. We're fortunate in that all 6 of our grandchildren live very close to us. 2 of them live right across the street. 2 live down about 3/4 of a mile, and 2 live in San Jose. So if I retired, I'm not sure I would spend any more time with them. When I was working full-time, we were doing some very interesting research. And I would be invited all over the world to give talks about the type of work I was doing. So my wife and I would travel. We traveled to Israel. We traveled to Australia, New Zealand, South Africa, Europe, Canada. So we at least would have 1 or 2 wonderful trips a year. My wife feels that she's traveled enough now. She doesn't have to see anything else, and she's very happy just to stay home. So if I wanted to travel more, I would have to start working on my wife about 6 months before the travel plans in order to get her to agree to go with me. So I'm not sure that I would travel anymore if I retire completely or not. We've been so lucky. I mean, I grew up in an exploding new subspecialty in pediatrics. I work and have continued to work with unbelievably gifted people. I've been lucky to have 5 healthy children and 6 healthy grandchildren. And except for a few problems here and there, I've had a very successful marriage, and my wife still puts up with me. My intentions for the future would be to continue to work as I am working now, as long as my health is okay. And I think that's going to be the determining factor, how healthy I am. If I can no longer do the things that I want to do or can do, then I think I would stop. So my agreement with the person who's my immediate superior, the division chief, that as long as I continue to do an excellent job, he'll keep me on. Good is not good enough.